the 20-minute wala patient?
Yeah. So different patients with the same condition. That's what. One with the osteoarthritis, one with weakness, one with each one was different, but the pain where they are feeling was in the knee.
Hmm.
But the approach for different people is different because their environment, their weather, the place where they live, there are so many things which is playing an important role in their recovery and also when creating the problem as well. So always we think only in the point of body, only in the point of body. If you think giving the solution is not just telling this exercise is easy, but how it is going to help them, that's what it matters. So we have to take every factors so that we can give them the sustainable solution because if it is a very short term or instant solution that can be provided by the medications and injections, there is no use for us to play an important role. Our role is to make them better for longer period of time so that they can live a pain free and a fulfilling and happy life.
Nice. So now I got the point, whole point. Now, can you tell me about your programs and about your practice, and can you tell me about more about how people can connect with you and which kind of problems they can come with? So, tell me a little about yourself, where you are based, what you do, how you do, about your programs, and a little bit. So
Yeah. So
viewers can get the idea that how to approach to you and with which problems.
yeah. So we have a website, telephysio.in. That is our website, and we have all the details. So every day we have free consultations. If they need to know how it's going to help them, they can connect on a free consultation. And if they are having a particular program problem, so we have provided what are the conditions we treat there. So if they go and click, so there will be a link for the paid consultation as well. So how we do the program, I'll tell it. So first they will connect on a consultation call. If they are coming for a paid consultation call, it will be with a 1 week follow-up plan as well. So we'll be providing the protocols also during the call after the assessment and things because it takes a little longer for us. Minimum 45 minutes to 1 hour. It depends upon the problems what the patients are facing. And after that 1 week, only if they follow up the protocols and they have been in touch because the 1 week follow will be completely through texting. In case any doubts, they need to be connected on a call, it will be done. And only if they're going through that protocol and they are doing things and they are updating us regularly, then we will take them to the main program. Because here the thing is, most of the time, people come for the program, then they will give lot of excuses. I didn't have time, I didn't have this. So that is not going to help them. Maybe I can give them the best solution, but until they try it and they do it and they're consistent with this, it's not going to give them results. So we
Hmm.
will make sure only if they are very consistent and they really care to come after their problem, we help. Or else we tell them openly because this is a policy of our company. If I can't provide value to them, the money what they are paying to me is not providing value to me in my bank account. So we
Hmm.
are very sure, we are very straightforward with our patients because here we are here to help them. So in that process, it is an 100 responsibility. So
Right.
it's two way. One way it cannot be happen. I'm not a magician. I give that and you don't do it, they will the results can happen.
Right. Right.
So not only with the physical issues, we help people with sleeping issues, anxiety issues, overthinking. So related to mind problem also we help them patients because everything is interconnected because some other way this will help them in their physical health. Because when it comes to physical health, it is not just about how your body moves. In
Hmm.
physical health, there are three important parameters. That is your activity, that is your movement and things. The second one is your food, and third one is your sleep. All these things plays in very important and major role in your life. So we make sure like are they doing everything in this aspect, and we will as a physiotherapist we can't just learn physiotherapy, we have to learn complete medical thing to help them because we have to know what kind of systemic problem if they are facing, what kind of medications they are taking. So each and everything, whether these thing is a major factor for the problem which is creating right now, then we have to help them to control in that area as well. Because there are few conditions when it comes to maybe people would have heard more of frozen shoulder. So frozen shoulder is like they can't after this they can't do the movement.
Yes.
So
Yes.
in that case, it is very common. for people with diabetic. So if they are diabetic, there is more chances they may end up with frozen shoulder. But here, the amazing part is your improving movement will help you diabetic at the same time. Your diabetic improvement also will help with better doing with the movement. So here, like we have to play on these things. So first thing is like
Do we
generally,
do we
yeah,
have a means like solution for the frozen shoulder?
yeah, yes, but it is not. It is a long term care. I openly say sometimes like patient says like they think they need one medicine to get sort of all the problems. It's not for frozen shoulder. If they're coming in chronic condition, minimum it will take from 1 year to 1.5 years to completely get out of it. But it can be done as it is a long term. If they are consistent, if they are following things within a year or two, they can completely reverse the frozen shoulder. But the thing is, it is a long term,
Okay.
but
Now,
they
because
should be ready for.
you're saying, and I am just imagining the patients around me that okay, this uncle has this problem, this uncle has that problem, this problem, and I can totally get that. Okay, you can help them in somehow because they
Yeah,
are finding some pharmacy or they are finding some like to medicine to get it into, and maybe the physiotherapist they are looking for, but as you said, there are so many other things to take care of for the
yeah,
problem. So now I'm going to
yeah.
tell that okay, I know some doctor. She is very good into helping in this
Yeah,
area.
exactly. That is the thing. When I'm into this 10 years of practice, I was thinking for one problem, going to these many experts is very difficult for a patient.
Uh-huh.
Yeah, so we thought it like, so we know all these areas because when we are studying, we have psychology as a paper, we have sociology as paper because all this paper is involved because we have to treat when a patient comes to us, all these areas, the problems are also there. And even we have to help their family as well. So when they're going through them, how they have to support and things like that. So we have studied all this paper. Then I thought, how about we create a holistic with imbibing technology? So that is where the telephysio born. So I was thinking most of the time, example in my place, example, we are in UP. So here the major problem, the commutation. From their place to come here, they may have like 1 or 2 buses. So from there to reach to the main town, it will take 1.5 hours, 2 hours. So if they come and they go back, the whole day ends.
Hmm.
So all these problems, so they may not get an expert near to their place. It's very difficult. In our place, the physiotherapy population is very less.
Ah.
So we thought it like we even started a clinic 3 months back to make them aware because this clinic is also set up in a form of more of technology aspect. So
Okay.
that is how we set up more of sensor, gamified and things like that. So we thought when they're coming in, they get used with this for a week or two, then we can help them don't travel because there is no way they have to take a vehicle for
Hmm.
them to come up and down, that will charge per day around 1,000, 2,000 rupees. It depends upon the location from where they come from.
Hmm.
So we were thinking like how would we provide solution by just sitting at home because right now everyone, at least one family member in a house will be having a smartphone.
Yes.
So that is more than enough and no one is kind of don't have a WhatsApp. So these two are very minimum requirement what we need to help a patient.
Okay.
Yeah. So and something few things cannot be done. Also, we have got a solution for those things. They can't come here, but we will give a solution where you can do it at home for
Hmm.
initial phase where a therapist is not needed because as technology is getting advanced. Because whatever the machines we are using in the clinic is majorly for the clinics, but there are few things due to technology where a patient model is also there. So it
Hmm.
costs very less and which comes until the therapy time for the patients to be used at all.
Right.
So that will save us a lot. So even we have a small machine, I can show you. So this is like we got it for neuro rehabilitation thing for a patient. So this is how the machine size is. So one lead has an on button, off button and on, that's the center, and there is a plus and minus to just increase the intensity. So it's very easy for a patient to use it. There is no complications, nothing. If they are having any problem related to stroke or any due to nerve the movements are completely not coming, this will help in initiating the movement. And what amazing thing, the cost of this maintenance is just 5K, which they can use it for 3 months. Yeah, because if we come for 2, 3 settings, then we have to pay a therapist more than that.
More than
In
that.
that case, if they just get this mention once in a week, they connect with the patients. It's going to be more cost effective for the patient. And at the same time, here they have to be accountable to the doctor. So at home, if the member of the family is going to tell the patient, you have to do this, you have to do that, doctor have said, they will not listen. But if every week there is an appointment with the therapist, so they have to meet the therapist, even online, it will be like virtual. So
Hmm.
they will complete all the tasks we have given to be done at home. So we see like there is no, what to say, they continue the things. They are more consistent once I started doing online than my offline practice. Openly to say, in online, their consistency is better because always they have me to reach out, and also in between I question them. Have you done with your programs? So they get messages, things like that. So they are aware someone is watching them. So even though we are not watching really in a physical space, but they are aware that someone is going to question us next week.
Right, right.
So they make sure they do it. That's
Nice.
the
So,
reason then physical online is working super amazing.
wow. So now you are like everywhere. So it means you can be treat from your place to anywhere in India
Yeah, anywhere in India.
or anywhere in the world. To be fair, to be
Anywhere in the world we can do, but right now I haven't started because I have to learn each and every market of the other countries because there are so many legal procedure because it is
yes,
related to your health. So as
yes.
it related to your health, because even this they will be filling a form, they submit, they get to give a consent, then only we take a patients. Without filling the form, we don't take a patients
Uh,
because they're
so
completely aware they're doing it online.
yeah, but in India also we have 1.4 billion people, so no problem. We can target them.
Yeah, sure.
So
Ma'am,
so
even in future, if they are going to come also, they have to work with me in IST. I'm not going to work them in their timing.
and doctor, what about any other telephysio kind of thing happening other than you around? There are.
No, I know a few people are doing, but they are not aware about the technology and other things. What is very peculiar about us doing good is like we are using a software where we make sure we send the reminders and things. So generally, the basic problem what people we see when we were doing on offline practice was if I teach exercise to a patient, they will do it. And suddenly they're not coming, they will say, Ma'am, I forgot the exercises. So this
Uh,
will be the very common thing. As an excuse, they tell us saying they forgot the exercise. That was the reason they couldn't do it. And during that time, most of the time they don't have a number to connect or things like that because they come offline, they see and they go. So this is what is happening. But here, what we do each day, day one, this is the protocol for next week. So even we will send them the protocols with the videos,
mhm.
with the descriptions, how many times needs to be done, what is the first one, what is the second one, what is the third one, even the order, everything we send them. So there is no complaint or no excuse they tell that I forgot the exercise, I forgot how many times it needs to be done, I forgot exactly the method, all this thing, they don't come up with the complaint. So we make sure like every solutions is available so they cannot come up with any excuses
Mhm.
for not doing that particular activity.
And they have the whole track record also that what they did till the day, right?
Yeah, they can have the track record, and we have even have a track options in the system. But generally, like we don't have provide the track link for everyone because when it comes to India, for working professionals, we give the track links because they can track it whether they are done it or not. It's a manual, but still they can track it. But for other people, for them doing so, is more tracking is in the WhatsApps. So
Uh,
very simple tracking. What we ask them to do is once they complete their exercise they have to give a thumbs up or done. Their routines are done because that is very easier method. So we don't want to make things very complicated for them. Because example, you know technology, I can ask you to track, you will go into the software and do it. For everyone, it is not the same. So we make sure what is working for them. we will give that model to them. So in the end, it should be simple. Doing the exercise matters. It's not about tracking. So every day, just sending a done message works for us.
That is super. So now, all in all, we have Dr. Sandhya for our physiotherapist needs, but this is telephysio, a little more advanced physiotherapy, where we can focus on like emotional and physical and surrounding.
Mental and social.
So many things, like my mind is blown that okay, I have to see so many things when any symptom comes out. If we have some pain also, we have to think that okay, we have other things to look at as a cause of this particular symptom. So
And more important, even our self talk matters a lot. What we are talking to ourselves, because when you're having a migraine issue, I've seen a lot of people with migraine issue. They say migraine will not get all right. Migraine is the problem; it will be there for lifetime. Migraine is this because they have gone through all this information which is available in the Google, and in the end, even if their body is ready to help them heal, they tell this thing again and again and again, and their body also accept it. This is how it is. I have to live with migraine for lifetime.
uh,
Actually, we had a lot of patients with migraine with a lot of other techniques to work on their mind and things like that. In that, it helped them a lot. And sometimes people get confused. We have one more problem. We think it is a migraine. It's not a migraine. It's called cervical headache. So whenever you are having neck pain, there is more chances you are pain in the back end. So this area will be painful. So this is all do with the cervical pain. So this also leads to headache. Sometimes people go to a doctor and take medications for headache, but the root cause is happening in their neck. So
uh,
until they get rid of their neck problem, this headache is not going to get rid of them. So there
mm,
are small things people are not aware about it. So we cannot complain about the patients because they are not aware. This can lead to this problem. And what's super amazing is there are some cases the root cause is in the ankle, but the pain is in their shoulder.
uh,
Yeah, so all this happens. So when we teach them here, right now you are having a problem here. So when we do the complete assessment itself, we'll ask you have a problem in your ankle as well. Then they said, I said shoulder. How you know that I have a problem in ankle? Because we
uh,
observe each and everything when we are looking into them. So where there is any small cues, we can get it. So this we may get it in the first session as well. Sometimes we get it after few sessions. It depends from person to person. Yeah, but during the process, they understand. Okay, so we have to focus on overall. We are not separately. There is no leg separate. There is no hand separate. There is no brain. There is no heart. Everything is wholesome. So that's why we are a human. So
uh,
everything have to work in their vibration, in their rhythm for us to be healthy.
right. And that's how you treat holistically, like
Yeah,
whole thing.
holistically. Holistically. So that is very, very important. And
Okay.
very important is, and recently there was a person who asked me, ma'am, you're a physiotherapist, then how you're working on mind? And I said, without the control of your mind, do you think your physic work? So simple thing. If you're going to eat, first you have to think and going to eat. Then only you're going to use your hand to the
Right,
movement to eat.
right.
First the thinking comes, then action happens. So yeah, the first work is done by the mind, the second work is done by your body. So if I'm not connecting these two, then it's very difficult for me to work as a physiotherapist.
Uh,
Yeah.
nice.
It's very simple.
Yeah. So now what we are going to do, we are like this talk can go on and on for all day,
Yeah.
but yeah, I would like to like I don't want to take so much of your time. So what we are going to do is I will put your website in my channel's description as well for every viewer in my channel, and I will share the link with you as well, and I will make sure that anybody who wants to have this kind of such problems and they want to use your methods to solve their problem, they will definitely connect with you.
Sure.
And thank you so much for the time you gave to me to talk. Like it was really nice. I'm still processing so many talks. What you just said. So I'm just still processing that. Okay, we have to look around, and you have to see so many things when you have some problem. It's not just like you just go to medical shop and take a one pill and you are sorted. It's not like that. We have to take care of so many things. We have to take care of our body as well. And I think that it's not just about that. After getting big problem, they should come to you. You are healthy also, they should consult you, that okay, you have to, maintain this health.
Yeah.
Right now what my thinking is, like, I should consult you not because I am having some problem, but I should consult you because okay, now I should not have any problems.
Yeah, exactly. At least it's a kind of like you should connect with me to know how you can take care of an health without getting any problem. So if
Yes.
someone want to live a disease free and medicine free and a pain free life, it's not necessary they should live it only after they are getting all these problems. Then
And
also they can
those
connect.
those people also who have a little pain,
Yeah,
and they are like neglecting those pains, that
that is
okay,
very, very
this
important.
afford, it's okay, and then after 1 year 2 year they will feel so much of pain, and then they will first seek a doctor.
Yeah,
Better than that, you should just acknowledge that pain and you should consult you, okay, that okay, this small pain is always there, something is there, something happening in my body, or some little knee pain is there, little back pain or a neck pain or headache or migraine or whatever. So
yeah,
if they are affording that pain, they should consult you to get rid of it, or it should not get more
yeah.
of. So
Exactly. So these
okay.
people are very important because, as you said, most of the time the neck and shoulder and everything, because they are in the sedentary, mostly using system, mobile phone, watching TVs. These are the one which is creating trouble. So sometimes, the most of the time, very common things happening in our body is some muscles are overworking, some muscles are underworking or not working. So
Right.
they have to activate this to have a overall health.
Okay. Okay,
Yeah.
doctor. So thank you so much for coming on my podcast and to talk with me about this telephysio. This is very new topic for me as well, and for I think for my viewers as well. So they will definitely get in touch with you, and I'll be getting in touch with you because I have so many patients around me for so many problems like that. So I will be in touch with you. Thank you so much, and thank you for
Yeah.
coming to my.
Thank you so much for inviting.
Thank you,
Yeah.
thank you, thank you, thank you,
Thank you
thank you.
so much.
I'll,
Yeah.
I'll be. Thank you.
Yeah. Sure.
Bye bye.
Bye bye.